Hello viewers, I am Dr. Rahul Reddy. Welcome back to ANDROCARE Connect program. This week we have a few questions. Let me start with the first question. First question is from Mr. Vijay Kumar. Sir, please make a video on switch therapy. Actually, it's not a therapy, it's a surgery, switch surgery. Generally, this is done for premature ejaculation. So I will definitely make a video on switch technique. Then coming to second question, somebody has said, why don't you use sleeves in place of condoms? The size will be great for partner, no early out. After that, remove it and complete the process. PRP. Okay. See, basically, sleeves are little thick in at least 80% of the people who use condoms, they are not happy with the condoms. They don't get enough pleasure during intercourse with condoms. So that is their main complaint. So now that is the reason people started using ultra thin condoms. So now sleeves are slightly thick in sensation. So the main feeling of erection penetration may not be there with the sleeves. That is the reason we don't suggest sleeves. Only for people with small penis and who want to satisfy their partners, that is where we advise sleeves. Then Mr. Ajay again, can penile Doppler evaluate complete penile blood flow examination? Can I do penile test in local diagnostic center or andrology hospital? See, in penile blood flow, there are two types of evaluations. One is macrovascular evaluation and second one is microvascular evaluation. So now microvascular evaluation, we have to assess how is their endothelial dysfunction. So how is the internal layer of the penile blood vessel. So that is called microvascular evaluation. Those things may not be available with diagnostic centers, but for penile Doppler may not give us complete information about penile erection. It will tell us whether there is any damage to the penile blood vessels or whether there is any blockage to the penile blood vessels. So that is why we always combine both microvascular evaluation and macrovascular evaluation. See, wherever it is done, it has to be done with an injection, and in case after with the injection, if there is any priapism, that means prolonged erection, and there should be a doctor to tackle that immediately, because if prolonged erection is continuing for long time, then immediately we have to give an opposite injection. Sometimes what happens, local radiologist will again ask you to go to a urologist. There it may take some time. So again, whenever you go to urologist or andrologist, at that time he should be in hospital. So it's better you do in an andrology hospital. If it is not possible for you, go to a local diagnostic center and talk to the radiologist first. And radiologist says okay, he can tackle priapism. Then you can go ahead and do penile Doppler wherever you want. And second thing is that radiologist should be trained in doing penile Doppler scans, because this is not a regular scan which is done. Okay. Then Mr. Mahesh, shockwave therapy cost. Okay, it costs you around, see, for erectile dysfunction, it will cost you around 50,000 for 6 sessions, approximately. One more question, sir, can I live with erectile dysfunction? Please tell me. See, erectile dysfunction will affect only your erections. It is not a life-threatening condition. It has no implications on your quality of life except sexual dysfunction. So don't worry, even if you have erectile dysfunction, nothing will happen to your life. Mr. Naveen again, sir, can you please explain in Telugu and upload it in Telugu AndroCare channel, because it helps to understand us clearly. Some of us not getting in English. See, Mr. Naveen, all these videos which are coming in English channel are already there in Telugu. Only thing is sometimes the subtitles or the title may not be apt for the subject. So All these videos are already there in my Telugu channel. So please go through. One more question. What is the reason of not to getting early morning erections? See, early morning erections, if you are not getting early morning erections, there are so many reasons. It can be testosterone deficiency, it can be thyroid problems, it can be vitamin D deficiency, or it can be vitamin B12 deficiency, or it can be penile vascular issue, basically dysfunction. So these are the reasons for poor early morning erections. We have to treat all these things. Mr. Vijay Kumar again. Malleable penile implant surgery అయిన తర్వాత sometimes once we remove any penile implant, penis will come back to normal size, but only problem is then you won't have erections, you won't have natural erections. So once we disturb the penile tissue during implant surgery, if you want to get natural erections after removing penile implant, you can't. So either you have to live with penile implant, or if you think you don't want erection, then we can take it out. Only thing is there will be shrinkage of the penis. Okay, one more question. Doctor, it has been 20 days since I had circumcision surgery. The swelling is still there. So is this normal? Yes, definitely. For some patients, swelling will be there for at least 1 month. So don't worry. Slowly the swelling will come down. Hello sir, is it possible to increase penile width and size and length? See, length can be increased only with the surgery. Even width we can increase. We have fat fillings, fat injections, but only thing is these things are not permanent. There are some sleeves, penile sleeves, which are into the market now probably, but they are not in India. It may take another 3 to 4 months for them to enter Indian market. Once that is available, what we can do is we can actually pull back the skin, we can put the sleeve and we can pull back the skin. So this is like circumcision surgery, but the girth increases. And Ashok, can you tell me about the drug Vitaprost for chronic prostatitis? See, Vitaprost is a herbal medication for prostate, but whether this can be used for regular prostate gland enlargement, but this may not work in case of chronic prostatitis. I think this is the end of this week's ANDROCARE Connect program. I will see you back next week with another video. Thank you.